Hello everybody, welcome again back at the Vitrolife Group Academy studio here at ASRM in Denver. We are going to resume our sessions, and the first session now after lunch is Dr. Olcha, who's going to talk to us about the implementation and use of the Sense needle. Dr. Olcha, over to you. Thanks.
Hi, thank you so much. So I'm Dr. Meir Olcha. I'm a reproductive endocrinologist. I did my training in New Jersey and New York. I practice locally in the area and have the pleasure of talking about the Sense needle, which I've been using for a long time. I'd say at least 5 years, if not longer. Probably like it's my go-to needle. I think the reps at Vitrolife know that when I move to another location, I always try to get the needle with me because I love it so much, and I find it difficult to do retrievals without it now. So anyways, so that's a little bit about me, and I'm going to talk to you a little bit about why I kind of like the needle and why I think you should probably switch to it if you haven't yet. So I don't have any disclosures. I don't work for Vitrolife. I'm just doing this out of the goodness of my heart because I think people should be using good instruments when they're operating. And definitely when I'm operating, whether I'm doing an egg retrieval or whether I am doing a laparoscopy, I try to use the best equipment possible. Let's see. There you go. Okay, so, I've talked to, I went too back. There you go. There you go. I talked to a lot of colleagues of mine about equipment, and, we always talk about different things. What kind of scope do you use? What kind of lens? And whenever I talk about needles, people are usually just saying, well, it's just a needle. Like, what's the big deal? And the truth is, just like you would pick a scalpel and you would pick any other instrument, I do think it's important that you pick the right needle. And being that egg retrievals are probably the most common procedure that we're doing as REIs, I would want to use the best equipment possible. So it's not just a needle. I mean, I think it's critical. People say it's a small component. Well, it's like the most important component. It's what's actually going into the patient's body. In fact, it's the only thing that's physically going to be going through the mucosa. So I think it is crucial. And then I hear a lot about how they're all the same, 17 gauge, 18 gauge, single lumen, double lumen. It's kind of all the same stuff. And I would argue that it's not the same, actually. It's, quite different. And then I think probably, the most difficult one to conquer is how to get someone to change when something works. And it's true. I mean, I've used a lot of different needles. I've used a lot of different instruments, and it's hard to get people to change. But I would argue that until you try something, you don't really know what the upsides are. So anyways, why did I even start using it in the first place? And it's because I just wasn't happy with the type of needles that were out there. So the most common needles that people are using are single lumen, kind of like a larger diameter, larger gauge needle. And it's a little bit problematic because it causes a lot of bleeding and it causes pain and discomfort, and patients are not very happy with it. So that's why I started looking for an alternative. I will tell you, there are not many alternatives out there. There are some. There are some other companies that make some very small gauge needles, which I've used in the past, which are very good, even as small as 21. But I think what you'll notice with this particular product is that when you are using a very small gauge needle to do an egg retrieval, you're not really able to get the same suction power from the needle. And you end up having a test tube that the follicle fluid just kind of drips, drip, 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 and so you don't get the same laminar flow through the follicle and through the actual tubing, and that's where you start losing eggs, right? And I've used these 20 and 21 gauge needles from various companies out there, and I find that you just are not harvesting all the eggs. So if you go into 20 follicles, you may only get 15 or 14, and you're just losing some eggs because you're not having the same suction power. And you'll see later, what makes this needle different is that it's not the same gauge throughout, and actually the needle starts small and then kind of tapers wider, which gives you a much better suction power. And this is something that we don't do a lot of in the US. Local anesthesia cases, I know they do it all in Europe, but I personally, in my clinic, I do a lot of local anesthesia. I think patients are kind of blown away by it. It's probably one of the nicest things because they're in the case, they're totally awake, and they're actually on the screen watching their eggs. Like they're literally watching their eggs come out of their body. And it's the coolest thing in the world. And it's very hard to do a solid local anesthesia egg retrieval if you're not using a very, very small needle. I mean, you just have to use a 20 gauge, a 21 gauge needle. Otherwise, you're gonna have a lot of difficulty with that. And so this product, in my opinion, just kind of hits the nail on the head there. So this is what I was talking about before about the tapering. So a regular needle, 16, 17 gauge, right? It's gonna be quite thick all the way through. It's gonna cause a considerable amount of pain and bleeding, and that's why we put people to sleep. The nice thing about this sense needle is that the part that actually goes in through the mucosa, in through the vaginal mucosa and into the patient is very, very narrow. It's 20 gauge. So they barely feel it. I can tell you with local, I always give lidocaine if I do local, and I wouldn't recommend doing anything else. But just like a touch of lidocaine, they don't need anything else. I do these cases every day, like pretty much day in, day out local. Patients are totally awake, they love it, and they have very little bleeding afterwards. And they're pretty much like up and out of the office in 5 minutes. It's pretty remarkable. So that's really the difference between the Sense needle, which is what the Vitrolife product is, and then pretty much any other needle out there. It's this kind of tapered edge. And I think that's really critical. I'm not sure if there's any other company that makes it actually. Okay, so let me see. The other thing, and these are things actually that I recently learned about Vitrolife, and I kind of knew intuitively, but I never knew that it was actually part of the design of the needle. But it is certainly sharp, and it is very echogenic. What I would say is that the echogenic part of it, in all honesty, is about the same as most other needles. You can see it very well on ultrasound, but it is really sharp. And where I notice it the most is if you are going to do an egg retrieval and you have an ovary in front of you, and if you ever notice, sometimes you go into an ovary and the ovary kind of bounces away, right? And the problem is that the ovary isn't fixed, right? It's kind of moving, it's mobile in the abdomen. So you go with a needle, maybe a 17 gauge needle, and the ovary bounces away from you, and you really have to put pressure. That is one thing I noticed with this that I don't need to do, because the needle is very sharp, and it's almost dangerously sharp, so you have to be very careful with it. But it will just go in like butter. And it's really nice to use. Again, like just personal experience. Like I said, don't work for Vitrolife. I just happen to like the needle. So a couple other things. So, they've studied this. I can tell you just my own experience is that patients do wake up with less pain. Patients do wake up with less bleeding. And for me, it's like a quicker turnaround time because I can do 4, 5, 6 cases and I don't have to sit there and hold pressure and wait for the bleeding to stop. It's just not a big deal. And then just in terms of recovery, they're in the recovery room for 25 minutes and then they go home. So this is what the patients say, right? Like, this is not coming from me. They're saying, hey, like, what did you do differently than your colleague? And I'm like, honestly, the only thing I did differently is I used a smaller needle. I don't do anything else differently. I don't think I do. And they're blown away by it. And to the point where some of them now request me, they're like, oh, is Dr. Olcha around to do the retrieval? And I'm like, sure, like I'll come up and do it. But honestly, the difference is, I'm not doing anything different. It's just a smaller needle, easier to go in, less bleeding, less pain, quicker turnover. And patients are just happy. Like I said, they wake up, especially from local cases, they get up out of that recovery bed in 2 seconds. I mean, they just walk away. I wouldn't do a local case with 30 follicles, but if you have someone with 5, 6, 7 follicles, a little bit of lidocaine vaginally, I tend to use like a very long spinal needle to inject the lidocaine under ultrasound guidance, bring in the Sense needle, do a couple of retrievals, and you're like in and out in 5 minutes. It's really nice. I think I have a video, maybe? No, not this one, the next one. Oh, so let me talk about like switching, because at some point I did switch. And I can also tell you that when I talk to colleagues about the needle, they're like, oh, I'm afraid to use it. What if I don't get eggs? So this is what I tell people. I say, find a case that is an easy case, a donor egg, donor egg patient, someone who's young, someone who's like 25, 30, is gonna have a lot of follicles, where you know that, God forbid, something goes wrong, like you don't get eggs out of the first 3 follicles, just go back to your old needle, right? That's the best thing to do. So I would say, find a case where you can switch out your needles if you have to, but you're not, right? You're not going to. You're gonna use the needle and you're just gonna get eggs, and it's gonna be the same as every other case, and it's gonna go really well. So that's how I would do it if I had to switch. Other than that, there's no training. I mean, the The needle is the same. It's got the same tubing, same tube, same test tube cap. Nothing else really changes, except maybe you'd have to calibrate it differently. I always calibrate my needles, so that's what I would suggest. Calibrate your needle, make sure you have good suction. And I think maybe this is the video. Yeah, so this is actually a video of a patient that I recorded recently. Is it going to work? It's a little bit slow. But the point of this was really just to show you that you can see the needle really clearly. Again, this is just my own patient that I recorded recently. It's not different than any other needle visually on ultrasound. It's quite bright, very easy to get into. I don't think you're going to see anything remarkable here. But like I said, if you're going to switch, if you're going to try the needle out, I would say go for someone that has a lot of follicles. This way, worst case, you don't like it, you just switch to something different. Other than that, like I said, it's like smooth like butter, very little bleeding. Honestly, I've never had to sit for more than 1 minute with a little bit of pressure on a ring forceps to stop the bleeding. And I've done cases with 17 gauge needles and 16 gauge needles where it's like a bloodbath and it's really terrible. So I would not wish that on anyone. I always say I treat patients like they're my family. Like this is my sister, right? So I would want to use the smallest gauge needle. When I get my blood drawn and they come at me with, this massive 17 gauge, I'm like, no. Where's the butterfly needle? I need the butterfly. Why not? If you have a small needle, why use something bigger, right? It just doesn't make any sense. So, this is kind of my take on it. Fast follicle decompression, right? Because you've got that wide 17 gauge part. The follicles just empty out instantaneously. You get the eggs just come out like crazy. Minimal bleeding. Patients are very comfortable. You can flush with a needle. I've never flushed with it, but you can. I've just never seen the need to. It comes with a little adapter to flush with it. Quick turnaround time, high rate of capture. I don't know, to me it's a no-brainer. I've been using it for 5+ years, so. I don't know if anyone has any questions about it or my experience with it or using it, but happy to answer any. How was that?
Dr. Schultz, thank you very much. Any questions at the moment? I actually want to ask you about, you talk about turnaround time. If we are having our patients, not having to introduce any anesthesia, they can, obviously leave faster, happier. Do you also see that can have an impact on the way that you plan your day, the clinic? It just changes everything?
Yeah, I'll give you an anecdote. So the most retrievals I've done in a day was about 22 retrievals. And the only way I did it is because it was 80% local cases. And I was covering 2 rooms. So we had one room which was all local and then one room which was anesthesia. So we would do local case, anesthesia. Local case, anesthesia. And that's how you become efficient. I will also tell you that, again, just anecdotally, when my patients move to local, when they move, and I know that's not what the point of this talk is, but just anecdotally, when I've had patients move to doing local anesthesia, they don't want to go back. They do not want to get anesthesia again. They don't want the IV. They don't want to be put to sleep. They don't want to have to wait there for an hour. And they want to just be able to walk home. So if you're comfortable, do it. If you if you have an RAI friend that does local anesthesia, I would say go shadow them for the day. If you want, come to my clinic. My doors are open.
That's very interesting. And like you say, it's maybe the implications are much bigger. It's not just about the needle. It's also about the effectiveness of the clinic, the workflow, and potentially also economic benefits eventually for the clinic itself.
Yeah, 100%. In the U.S., the average cost of anesthesia for an egg retrieval case is about $650 to $800. That's a lot of money, right? That's a tremendous amount of money, and that doesn't include the pre-op care and the post-op care and the IVs, right? That's just the cost of anesthesia. It doesn't include the efficiency of the doctor who can do 8 retrievals instead of just 3 for the day. So, but you're talking to someone who is a very big fan of a local anesthesia. But yes, I think it's hugely beneficial, but you need the right staff, you need the right workflows, you need the right equipment, and then you could do it.
Great. Just want to check one more time. Any questions from the audience at this stage? No. Dr. Olcha, thank you very much.
Thank you.
Bye-bye.